Well, thank you, Gino, for that wonderful introduction, and thank you, Sergio, for a wonderful presentation on behavioral health needs of Latinos. I just have to say, it feels so good to be back in Washington State, rain and all, and it feels wonderful to be among colleagues and friends again, and I look forward to spending this day with you. I need to acknowledge and thank the Robert Wood Johnson Foundation Center for Health Policy at the University of New Mexico, who supported me coming today. When Gino asked me to be on this panel with Sergio, it really challenged me to think about what I have to offer here. I am not a mental health practitioner, never have been, and so I can't speak from that perspective. But I hope to bring to you today some things to think about from my perspective as an old public health nurse who worked in the Yakima Valley for a long time, and from someone who has always thought about context. So even as a nurse working directly with families, then as a healthcare administrator, now as someone who studies social policy, context and how that contributes to the health of the folks we're talking about. So let's see here. Okay, so if we talk about Latino health, Latino mental health in Washington State, we're really talking about the story of two groups. And I'm not talking about Mexicans and Cubans and Puerto Ricans. I'm talking about two primary groups of Latinos we have here in Washington State. We have a group of parents, thank you, Megan. We have parents and adults, over half of whom are immigrants. In Washington State, 53% of the adults in the state who are Latino are also immigrants. And we have children. Over 90% of the Latino children in Washington State are U.S. born. These are very distinct groups with very distinct experiences, living and raising one another and living in communities together. We know that the seeds of mental health are often sown in childhood, and I appreciate Sergio's references to the importance of attending to the needs of children and the mental health needs of children. I'll make the case that the greatest leverage we can get on prevention of mental health and other health problems is to support children and young families for them to be healthy and functioning in their communities. So just a couple of slides on demographics. I'm not going to spend a lot of time on this, but just so we orient ourselves to what the Latino community looks like in Washington State. And certainly lots of variability that we're not getting to here. But we know as nationwide, in Washington State, the Latino population is young, very young. So this is just a chart of Latino population by age, and you can see that most of the population is down in very young years. While the total population of Latinos is over 700,000 in the state, those that are 19 and under, those that are children, are almost half at 42%. So this is a population structure that I think can inform us about what our future services need to look like and how we can be working to support these families. If we look more closely at the child population of Latinos in Washington State, we see that that child population is changing. And I'll ask that on this chart you pay attention to that bottom blue bar. So across we have the 4 age ranges, and then the blue bar represents native-born children, so children born in the United States, who are being raised by a foreign-born parent, at least one parent who's foreign-born. And as we can see, that portion of the child population gets bigger the younger we go. So it starts out something over 20% in the 15 to 19 population, but goes to over 50% in the 0 to 4 population. So increasingly, these are the families, these are the Latino families in Washington State. Foreign-born parents, at least one parent who's foreign-born, and native-born children. And we know from research that immigrants may bring with them health when they come, right? We know that many Latino immigrants in this country actually have better health outcomes than one would expect looking at their socioeconomic status. But this group of children that are being raised in the United States often don't have that same immunization for good health. And they often are at risk for many poor outcomes, including mental health outcomes, that their parents may not experience in such large numbers. So what do we know about these families? We know that the children are more likely to be born in the United States, that the parents are more likely to be foreign-born, and foreign-born parents, foreign-born adults in the state, are much more likely to live in poverty. Almost 3/4 of the foreign-born Latino adults in Washington state live in poverty. We know that they're more likely to have low education levels, about 10 years for both men and women, and they're less likely to be citizens. Fewer than a quarter of Latino foreign-born adults are citizens in this state. So this is really, we're getting a picture of the modal condition for Latino children in Washington state. There's, again, a lot of variation I'm not looking at here, but the most common situation for Latino children is to be U.S. citizen, at least one parent foreign-born, to be living in a low-income family with parents who may not be citizens and have low education. And research tells us that while, as I said, immigrants bring with them mental health, these conditions and these experiences contribute to potentially poorer outcomes for their children. So we know that how Latino children in Washington will fare in terms of their health and their mental health depends to a great capacity on the ability of our communities to both serve, meet the needs of these families, but also to integrate them into our communities. And that's kind of where I want to focus today, is on how do we do this? How do we serve, support, and integrate immigrant families? I would draw your attention here to this, what we know about the social determinants of health. We know health is produced at multiple levels, right? Health is produced at the individual level based on choices we make and health behaviors, but it's also produced within the family. It's produced within the community, and I think the community-based participatory research model we've talked about today speaks to that and strengthens that. But it's also produced by societal structures, including policies. And these structures within which our communities and our families are living has a great deal to do with their health opportunities, their opportunities to make choices that are going to benefit themselves and their families. We also know that health is produced over a lifetime, that there is a life course trajectory to health and illness. The social structures that children of immigrants experience in our communities today will certainly impact their health and mental health they experience as adults. Sergio mentioned the Adverse Childhood Experiences study, and I think that, among many other studies, has showed us that what happens to children matters in terms of producing health and wellness, and in some cases illness, later in life. So I'd like us to think about the experiences that Latino children being raised by immigrant families have had in the last 20 years and continue to have. We know that over the last 4 decades, there's been huge increases of immigrants from all over the world to this country, largely Latino and Asian immigrants. And we know that that influx has produced, in some cases, backlash in some communities, in some states, backlash against Latinos and against immigrants. We see this at the policy level for sure. We saw in 1996, for those of you who were around then, that immigrants were largely excluded from many social welfare programs. There was federal laws to exclude people and make sure that immigrants didn't participate, even legal immigrants didn't participate in social welfare programs. In the 2000s, we saw a huge increase in the number of states who were adopting anti-immigrant laws, exclusionary laws, trying to deliberately exclude immigrants from participating in public life in the hopes that they would self-deport, right? Those are the environments within which many Latinos are being raised, many Latino families are trying to raise their children. Now, in Washington state, we've been very fortunate. We haven't seen a lot of those huge exclusionary policies. At the state level, we've seen great support for immigrant health work. I remember we were one of the first states to establish prenatal care programs for undocumented immigrant women. Washington state continued to fund those programs, even with the exclusions of the 1996 welfare reform legislation. And we continue to provide Medicaid funding state-only for undocumented immigrant children. But still, these are the larger societal policies and messages that are often being sent to children and families and immigrants, even within our own state. I know in Yakima County, our county was one of the first to participate in the Secure Communities program when it became an option. So that sets up barriers between law enforcement and the community. So these exclusionary policies have the potential to impact how well our families are integrated into our communities. So knowing this, what do we need to do to support children and young families to be healthy and to function? Well, I would argue that we need to do many things on many levels, but today I want to talk about policies. Programs are important, but policies are better. So this is a young public health nurse doing a home visit in about 1990. For those of you who know me, it's always been about the hair. That was big hair. 1990 was big hair. This is a real home visit. The College of Nursing wanted to take pictures of me on a home visit. So this is a real home visit, real newborn, stethoscope and all. When I graduated from nursing school in 1989, it was the same year that Washington State passed the Maternity Care Access Act. For some of you who remember, that was first steps. That was expanded prenatal care, that was outreach, that was home visiting, that was mental health for women who were having babies. And I had the wonderful fortune of going to work in Yakima and establishing those programs there. So I worked as a public health nurse and established maternal child home visiting programs and oversaw the staff who did those home visits for many years. And it was a wonderful way to get to know the community and to really support the community. But it's a program, right? First Steps is a program. Programs are wonderful. Programs are needed, absolutely are needed. But they are politically vulnerable. They are vulnerable to funding cutbacks, as we've seen with First Steps. That's changed and morphed a lot over the years. And ultimately, they are ameliorative. If we believe and understand that social structures really are creating the context within which disparities and inequity happen, if we understand that racism in our society is institutionalized and continues to impact the lives of the families we serve, then the programs can never be more than ameliorative. That doesn't mean they're not important, but it means that they're not enough. And we need to do more to change those structures within which our families function. And so structures in terms of public policy, in terms of changing power structures and power dynamics. And there are lots of different places that can happen, right? Policies institutionalize our values. Policies allow us to institutionalize funding structures and power structures that will go forward. I'm thinking here not of health policy, but of other kinds of policies. Immigration policy is one of those. Education policy, early learning policies, and policies that reduce residential and school segregation, which still is just incredibly widespread, even in Washington State. So what kinds of structural changes do we need to make in the social environment in which people live that will help them thrive, will help families and children thrive and ultimately prevent these bad outcomes that we're concerned about? I want to talk about a particular kind of policy that I'm very interested in, integration policy. I mentioned the exclusionary policies of the 1990s and the 2000s. So the opposite of exclusion is inclusion. How do we create policies that will include immigrants and their families? How do we incorporate and ensure people are incorporated into our communities? I was asked before the conference in preparation to provide readings, and these are the 3 readings that I've included in references to in your packet. I'll just briefly reference them here as they relate to immigrant integration policies. The first is Edna Villarreal Fuentes, who is a public health researcher who's done wonderful work in Mexican families and communities. And she calls us to move beyond cultural explanations of health disparities. Not that cultural explanations aren't relevant, but they're not enough. And she calls us to move toward focusing on place, that's community, where people live, and on the policies that impact them. The second is Irene Blomgrad, who's a policy scholar. This is not a health article, but she does a great job comparing Canada and the United States, and this is true of other traditional immigrant receiving countries, Australia, New Zealand, United States, Canada. The United States stands out as having the really lowest level of immigrant integration policies among these countries. And Dr. Blomrad does a nice job highlighting how Canada has institutionalized immigrant integration. So the expectation in their society is that immigrants are welcome, first of all, and then that they are integrated into the community, and they put public resources toward making sure that happens. And when you think about it, in the United States, it's not even a question we have. No one, well, very few of us are asking the question, how are immigrants integrated into our community, and where are the where's the public investment and where's the public expectation that that'll happen? It's really the exception rather than the rule. But think about it, what are those institutions that perform integration? In our society, the two biggest institutions are community colleges and K-12 public schools. Community colleges do a great job, they're all over the country, and they offer English classes, usually oversubscribed English classes with long waiting lists, right? Lots of people want to take English and can't get into those classes. The other large institution that does this is the K-12 public education system, because there are federally mandated programs targeting immigrant families, programs for English language learning children and programs for migrant children. And those programs often require a parent involvement piece. They often require a parent leadership component. And so we see that when those programs and when those systems work well, and I think in Washington State most of our school districts do this well, that parents often have their first opportunity to volunteer, to participate civically through their child's school. And the schools that do this well engage parents in that. And I've seen lots of leadership come out of schools because of that. But much less do we have those institutions that are in Canada and other immigrant-receiving countries that welcome and help integrate newcomers to communities. We have programs at the local level, certainly. I know in Yakima we have La Casa Hogar that does a wonderful job providing civics classes and English classes to women in the neighborhood, but very, very small compared to the need that exists, so a drop in the bucket. And privately funded by churches and other religious organizations, so vulnerable to the ups and downs of available funding. So in the absence of really substantial integration policies and programs, where do Latino immigrants learn to be a part of their communities? Not only have their own needs met, where to go to have their own needs met, but where to go to contribute to make their communities better. Because inclusion is good for health. Exclusion is bad for health. Inclusion is good for health. I'll just mention quickly this last reading, the Littleton Immigration Initiative. This is not an academic piece. So this is a case study, a short, very readable case study. The folks in Littleton, Colorado, a small town of about 50,000 in Colorado, noted that there was a large immigration, largely Latino immigrant influx into their community. And the community leaders took it upon themselves to create an integration initiative. So they set up policies and structures to do this, to make sure that immigrants knew they were welcome in their community and to help them navigate systems and get to know people who were already in town and allow those residents of that town to support and help bring immigrant families along as they got used to living in the United States and negotiating the policies and systems here. It's a wonderful case study. So in the interest of helping inaugurate this new Latino Health Research Center, I will leave you with some important research questions that I would be interested in if I were studying Latino health in Washington State, more at the policy level. How do state and local policies support and serve as barriers to successful integration of Latino immigrant families as fully functioning members of their communities? What state and local institutions are most effective at doing this? Are there best practices that can be replicated? And how do non-health policies that support immigrant integration impact health and mental health outcomes for immigrants and their children? I'll leave you with that, and I'll look forward to your questions and comments. Thank you.
We have a few minutes to pose questions, and just like earlier this morning, microphones are available to present your questions.
Good morning. My name is Monica Feliu Mohed. I'm with the University of Washington Department of Biostatistics. I'm a scientist and science communicator, and I was wondering, what do you think is the role of science and health communicators in helping address some of the disparities in health and in literacy? And how can, as a science communicator, how can we collaborate with institutions and people who are doing research in this community to address these gaps in knowledge?
Can you hear me? Yes. Yeah. Wonderful question. I really like it. Sometimes I have thought that if I were to live again, I would, instead of being a physician and whatever else, I would be a communicator. Because, translating whatever knowledge is generated, and hopefully that knowledge is going to be generated along with those who are to stand to benefit the most. So they have a saying on what matters to them. The translation and the communication, dissemination and implementation is of critical importance, because otherwise it's going to happen the way in which it usually happens with us academicians, that, labor of 30 years, 40 years goes into shelves, that if we're lucky, is going to go into journals that had at the most 30,000 people who are going to read them. And no one is going to benefit from that. So I think that that breaching of what you do is of critical importance. We are also notable academicians for not knowing how to really simplify the message. We tend to be very, complex. And I think that simplicity is an incredible thing. And to learn how to translate the information at the sixth grade level, for example, is something that I very much admire from reporters, and from communicators. So critical importance. I think that unfortunately we haven't been able to bridge with health communicators and reporters. Is something that we ought to be doing much, much more.
Hi, my name is Marcos Martinez. I work for a community-based organization here in Seattle that serves the Latino LGBTQ community. And I want to thank both of you for your excellent presentations. And my question is about how can we best support and include Latinos who are LGBTQ. Very interested both in terms of the issues that you raised about mental health issues, and also in terms of youth and young people, and how can we support families in order to ensure the best outcomes for young people who are LGBTQ. Thank you.
So I think from a contextual perspective, my first response to your question is again about inclusion versus exclusion, right? That exclusion is bad for health and inclusion is good for health. So how do we create systems and communities that are going to be inclusive and support children and families in all contexts, in all circumstances? And I don't know of the specific programs that might be implemented here, but I do know that policy is important. And in this state, we've been very fortunate to have supportive policies for LGBTQ populations. So I would start there, and I would think about challenging our systems on how inclusive they are, and interrogating them as to what they're doing to make sure that they are inclusive of people coming to them for help, able to serve all types of families, and supportive of families as they grow and change.
It's a fantastic question, and very much needed. We need to engage in open, conversations about that. The report that I presented about it was focused on Latinos, but there is a report in California under the California Reducing Disparities Project that is focused on LGBTQ populations. It's called something like first, do not do harm. And in our report, we had focus groups with Latino LGBTQ populations that I was present at. And I cannot tell you how much I learned about that. You know, I cannot tell you how much, powerful testimonials and experiences were shared of the stigma and the social exclusion that not only they experience, in the context of families, but in the context of the LGBTQ populations themselves, with whites, for example. So there is the theme that really emerged is this issue of exclusion and discrimination, basically. And, clinics usually don't know how to treat appropriately this patient population. So I think that it is about time that we, as Vickie said, beautifully said, move very actively into issues of inclusion, how we can include them and make these populations feel like they are, part of the family.
First, I wanted to thank you to the organizers of this conference for putting it together, and thank you for bringing people in mental health issue, because it's a big issue in our community. I have experience working with the media, and I believe we are not doing well, okay? If you go to our Univision channel, what they represent then is a lot of cartel people, and this is not the face of the Latino community. And this is not something that we shouldn't be proud of. We shouldn't do something, because our community have many issues. Like, for example, not have a paper giving us not to go at the places, like you say, because when we go there, people are scared to be deported, How we can, as all of us leaders of the community, engage our community to get, proud to be Spanish. I came from Maryland, and most of the people there are from Salvadorian. They don't want the children to learn Spanish because they don't want people to be identified as minority. Start from there, and then to you that had the possibility to speak out and talk with people in the government, how you want us to collaborate with you, how we can change this. I believe we shouldn't take responsibility first us, as community, not say what the people can do for us, but why we cannot start doing something for ourselves. This is mine.
I think that I'll just make a brief comment, and then I'll allow Sergio to respond to the majority of your question. I think that the media problems you identified, I appreciate that you believe we should take responsibility and leaders should take responsibility, absolutely. That's part of leadership. But media representations of populations of color and misrepresentations are an example of institutionalized racism, and that is not something that we need to take responsibility for responding to that, but that is not something we created. That is not a problem the community created. That is a problem another institution, the media, created. And yes, we need to respond to it, and that's part of what leadership is.
I applaud you because you share those thoughts, and those were beautifully said, and I think that there is a lot of work that has to be done, not only with the media, but any organization, any entity that would allow us to emphasize the positive aspects of Latinos And I can tell you, based on 3 decades of research, that there are many, actually, there are many than the negative aspects. We are notable for many protective factors that we bring, as immigrants, for example, that come not only to the US, but to any country, really. We tend to be healthier, work harder. In spite of the many, many stressors and the many adversities, we thrive. One of the topics with us is resiliency. We are incredibly resilient. I can tell you a very quick story. When I did my PhD, and I did it at Vanderbilt University, but I did a couple of years at UC San Francisco, including postdoctoral year. I was doing it with Ricardo Munoz, who is notable about the prevention of depression. Is a pioneering work. And I remember that we were trying to determine if we could prevent depression, okay? That was the big question. And I said, I'm going to get a population that I'm very interested in to try to demonstrate that it's possible to prevent depression. So I focus on farm workers. I was wrong, and I was very wrong because I was picking the worst population that I could pick because farm workers are notable for the resiliency that they have. They really, really need to be beaten up. I mean, for a generation, for years, across years, as we documented, in order to see if we could prevent depression. This is just to emphasize that there are so many things that we have to be proud of. I mean, proud of. And if we were to really did to what you exactly did in a public forum like this one, and to stand up and say, wait a minute, there are many things that we can disseminate through the media. Certainly Univision, Telemundo, TV Azteca, you name it. There are many, many outlets, Radio Bilingüe in the Central Valley, Hugo Morales, the Mixtecos. And I, quite frankly, I feel that there is some of these things catching up. That there is a trend, an uptrend, that if we get into the bandwagon and collectively we, emphasize the positive aspects that we have, we can change around. And our kids are going to be proud of speaking Spanish and of the roots that we have.
Question, there was a gentleman in the back.
I'm not sure how to formulate the question. My name is Herman Rodriguez. In reference to the 5 A's that you mentioned during your presentation, one of the things about in the Spanish community is that the stigma that comes along with mental health. And I was not surprised with the numbers in Washington State because, we don't recognize that we have mental illness. The closest that we are to that is los nervios,
Yeah, right.
But it's still a problem with our community because that's not an existence. The other thing in my experience working with Western State Hospital is that it seems to me we believe we have a diverse community within a Spanish-speaking community, diverse. It seems that in terms of treatment, is that we have this cookie cutter model, and that doesn't apply for all the members of our community. And that's another problem that I see in the whole process to even treat the people with our community with mental illness, and the whole idea that because you have a Spaniard last name that you must be Hispanic or Latino. When I got someone referred to me that the primary language was Quechua, not Spanish, that was the second language, you say, okay, this is a problem here because we're treating somebody Hispanic when they really It just turned out to be in a country that speaks Spanish as a main after 400 years of Spanish domination. I'm not sure. It just this is more like a presenting your project. You might want to add another letter in your 5 letters in there, because I think the stigma with our community and the type of treatment that our community is receiving, I don't think we are really dealing with that issue realistic.
Yes, yeah. Oh, excellent points. Thank you for those comments. Let me tell you that My Alegría did a national survey, the National Latino and Asian American Study that David Takeuchi, that was here with you, joined, doing the Asian and Pacific Islanders. And Maggie reported in the national survey that over 50% of those who suffer from major depression had no idea, and often when they experience that they are falling apart, they don't know what to do. Sometimes they go to the emergency room, or they certainly go to the general physician, because recognition of the symptoms is a big challenge. Now, the treatments that are going to be appropriate for our populations also is a challenge, because most of the evidence base that has been derived on treatments that have been identified as effective don't use Latinos or have not used Latinos. So there is a lot of work that has to be done in adaptations of evidence-based practices to tailor them to Latinos. Guillermo Bernal has a wonderful book, also, Leo Cavazas, he sent me just 3 papers recently. Beautiful work on these adaptations and the thinking that has to go through it. But, this is the value. I cannot tell you how happy really I am genuinely to see that you are coming up with a Latino health center, that Dr. Dizis came to talk about it. Your passion, Leo, and the whole team, because it's so much needed. There is so much work that has to be done. And a lot of this work, it is not new, that work that people like, Vickie, Hanka, Valderrama, many that I can name, and the wonderful work that you have been doing, the track record that you all have. So looking forward to have this Latino Health Center thrive, and to be a part of it. I'll be more than happy, to be present and to help promote it and look for funding and sustainability, those kind of things.
Let's give a big round of applause to our speakers.